Joining the Good Health website. And I'm here to introduce our doctor, which we've used here in Mexico for the past 10 years, a functional medicine specialist. And we'll let him discuss what he does. His name is Dr. Juan Garcia. Dr. Garcia?
Thank you very much, Dan. Hi, everybody. I hope everybody's doing very well. Well, I have been working in this field for about over 20 years. When I was in medical school, I used to work in a very well-known alternative hospital here. So I worked there for, I don't remember, it was 2 or 3 years. I was on the night shift, so I got to learn a lot from the nurses and the treatments that were done at that site at the time. When I got back as an MD, I worked for 7 years in Sanofi, which is a very large holistic place, and that's where we got some training in functional medicine and the usage of all the supplements and natural therapies to offer to our patients. It was, I will be real honest, it was hard for me at the beginning to have the mentality or the training as a regular MD to switch, but I fortunately had the training before while I was in med school, and I was exposed to a lot of the treatments like the ozone and amygdalin and some other things. So that was very helpful for me, and it made it a little bit easier for me to switch. It doesn't mean that I'm not a conventional MD, I'm still a conventional MD, but I practice more the functional approach. Try to go from the less aggressive towards the more aggressive kind of treatment, as well with studies from the less aggressive towards the more aggressive. We try to do an evaluation of our patient with blood work and images so we can determine what's going on, and from there we will see what's going to be the best option of treatment to our patients. In some cases we have to use, if there's only a chronic degenerative disease but it's not a cancer, we can use stem cells, we can use immune boosters, we can use many things to help us detoxify, to enhance our health. In other conditions, if we have cancer, we can use probably natural killer cell therapy, dendritic cell therapy as well, plus also all the nourishment IV. The results in general are good. We try to stop the progression of the disease and then see how much we're going to be able to revert it. When we have stages that are very advanced, sometimes we have to deal more with complications from the disease than the disease itself. So that makes it sometimes a little bit more difficult. If we get earlier stages, we are able to work more with the main issue and not too much with the complications. So we are able to stop progression and then see how much we're going to be able to revert. A lot of the times we make recommendations to our patients as well, what they should probably eat, how to handle a little bit of macro and micro environment as well. When I say macro and micro environment, is our micro environment is going to be our house or office that we can control. Once we go out in the macro environment, we have to be cautious, but we're not going to be able to manipulate that. Also, we have to be aware that we can have, we have the genetics, which we are not going to be able to manipulate, but the environmental factors like diet, exercise, hydration, supplementation, we're going to be able to work with them. So we can have the proper nutrition, proper hydration, improve our detoxification pathways, all of that will help us in the long run. Right now, I have been here in this place on and off for about 7 to 8 years. I work with a group of very good nurses. A few other doctors are here with us as well. And we try to see all chronic degenerative diseases as well as cancer. Most of our patients come for 1 week to 2 weeks. It will depend on each condition. Our patients are able to stay here in our building. Well, the building that we are in is basically a hotel. And the clinic is a little bit in between the 2 buildings, of 2 towers of the same building. So most of our patients stay here in the hotel. They just come down to the clinic, get their treatments, and then they have the rest of the day free. Another advantage here is we have access to all the images that we require, ultrasounds, MRIs, whatever we need, blood work as well, anything that we require. And for our patients, when they have some free time, there are a lot of restaurants around the area as well. The area is very safe. We have never had any issues, us or our patients, on the street. And I always say on the safety, it's like any other large city. When you go to LA, New York, Chicago, Mexico City, China, you can find trouble if you're in the wrong place at the wrong time. But this area so far has been very safe. Thank you very much.